and pharma experiments. Okay, then we have grand viva. Okay, so let's talk about the spotters. Spotters are for 4 marks. Okay, so let's talk about pharma spotters. The spotters, you have drug, chemical structure, instruments, diseases, plants, scientists. 5 types you have. So this is what, this is acetylcholine. This is acetylcholine. How you will identify? You will see the quaternary ammonia here. So it is acetylcholine. It acts on nicotinic and muscarinic receptors. It acts on nicotinic and muscarinic receptors. Actions on heart. Acetylcholine blocks cholinergic system. So it decreases heart rate, it decreases force of contraction and conduction velocity. It does not affect contractility. Okay, so force of contraction, conduction velocity, and it decreases heart rate. Talking about dopamine. Dopamine is a catecholamine. This is amine group and a benzene ring. Benzene ring with the OH groups is dopamine. Is dopamine. Is dopamine. So in acetylcholine, it is the acetic acid ester of choline. It is acetic acid ester of choline. It is acetic acid ester of choline. It is acetic acid ester of choline. Presence of highly polar ammonium group doesn't penetrate lipid membrane. So this is polar. It is having charge. So it will not penetrate the lipid membrane. Attacks on nicotinic and muscarinic receptors. That should be there in your answer. Nicotinic and muscarinic receptors. M action, muscarinic action on heart decreases conduction velocity, decreases blood pressure, decreases force of contraction, decreases heart rate. It increases GI secretions. GI secretions, but heart pay all inhibitory effect like decreased conduction velocity. ठीक है, acts on nicotinic and muscarinic receptors. M action on heart decreases conduction velocity, blood pressure, force of contraction, heart rate, increases GI secretions, and initially twitching, fasciculations, depolarization of NMJ and paralysis, increased blood pressure. So, nicotinic action, initially twitching, fasciculations, depolarization of NMJ and paralysis, increases blood pressure. Talking about dopamine. So dopamine is a catechol nucleus. You can see this is a catecholamine. Dopamine is a catecholamine. It has catechol nucleus. Okay, a benzene. What is a catechol nucleus? A benzene ring with two hydroxyl groups at carbon 1 and 2, and one amine group. Okay, it acts on D1, D2, B1 receptors. Okay, it uses is, what is the uses of dopamine? Cardiogenic shock you give, septic shock also, cardiogenic, septic, and severe heart failure with renal impairment. Severe heart failure with renal impairment. renal impairment, severe heart failure with renal impairment, severe heart failure with renal impairment. So septic shock with severe heart failure and with renal failure, you give dopamine. Adrenaline. Adrenaline is also a catecholamine. It has catechol nucleus. Benzene with 1 and 2 hydroxyl group, then a NH group, amine group, okay. Methyl functional group at the nitrogen atom is present. There is a methyl functional group here. Acts on receptors alpha 1, alpha 2, beta 1, beta 2. So it acts on alpha 1, alpha 2, beta 1, beta 2. So methyl functional groups at the nitrogen atom is present. Acts on receptors alpha 1, alpha 2, beta 1, beta 2. Uses anaphylactic shock. What is the use? Anaphylactic shock, bronchial asthma. What are the uses? Methyl functional group at the nitrogen atom is present. Acts on receptors alpha 1, alpha 2, beta 1, beta 2. Uses is anaphylactic shock, bronchial asthma, cardiac arrest, duration of LA prolonged, epistaxis controlled. So its uses is anaphylactic shock. Anaphylactic shock. Its uses is anaphylactic shock, bronchial asthma, cardiac arrest, duration of to prolong the duration of local anesthetic, epistaxis control. What is the uses of adrenaline? It's very important. A, B, C, D, E. Anaphylaxis, anaphylactic shock, bronchial asthma, cardiac arrest. D, to prolong the duration of local anesthetic and epistaxis. Epistaxis मतलब नाक से खून बहा. So you can give adrenaline in that case. Adrenaline in that case. What are the uses of adrenaline? A, B, C, D, E. Anaphylactic shock, bronchial asthma, cardiac arrest. Okay, to prolong the duration of local anesthetic and epistaxis control. Okay, now let's talk about the what are the receptors? Alpha 1, alpha 2, beta 1, beta 2. Noradrenaline. Not it is also having catechol nucleus. How you will differentiate? If there is a methyl group, it will become the adrenaline. But nor means no methyl group in case of noradrenaline. Methyl functional group at the nitrogen atom is absent here. It acts on the receptors alpha 1, alpha 2, but beta 1, beta 3. Beta 1, beta 3. Adrenaline beta 1, beta 2. Alpha 1, alpha 2, same. Alpha 1, alpha 2, same. So what are its uses? What are the uses of noradrenaline? Hypotension. Whenever the BP is low, you can use hypotension to increase the blood pressure. Cardiogenic shock. So if the patient is having cardiogenic shock along with the hypotension, go for noradrenaline. Morphine. Talking about morphine, so this if you see benzyl isoquinoline ring structure pentacyclic 1, 2, 3, 4, and this one also. Total 5 are there means morphine. Two hydroxyl functional groups are present at third and fourth and third and sixth position. Third and sixth. Two two hydroxyl groups are there. Pentacyclic. Okay. Tertiary amino group at 17th position. Tertiary amino group at 17th position. Tertiary amino group at 17th position. It uses analgesic. Analgesic. दर्द कम करता है, you will give morphine. Analgesic. Antidote is naloxone and naltrexone. Antidote for morphine poisoning, naloxone and naltrexone. Naltrexone, you can give naloxone and naltrexone for morphine poisoning antidote. It is opioid analgesic, pain relieving. Okay. Here you have tertiary amino group and 17th position. Let's talk about corticosteroid. So 21 carbon ring structure containing cyclopento perhydrophenanthrene ring. Oh, corticosteroid 21 ring carbon ring structure containing cyclopento perhydrophenanthrene ring. Here only 4 rings are there, 1, 2, 3 and 4. There are 21 ring carbon ring structure. It contains cyclopentoperhydrophenanthrene ring. Glucocorticoid activity requires hydroxyl group at 11th carbon. So there should be a hydroxyl group at the 11th carbon. Hydroxyl group at the 11th carbon. So total 21 carbons are there. At the 11th carbon there should be hydroxyl group or H group to work for glucocorticoid. Okay. How you will identify glucocorticoid? 11th carbon there should be hydroxyl group. Mineralocorticoid activity requires presence of OH group at 21 position. Mineralocorticoid 21 position पे OH group. Use is anti-inflammatory. Adrenal insufficiency. If adrenal insufficiency is there, use glucocorticoid. Anti-inflammatory, anti-adrenal insufficiency. Glucocorticoid activity requires hydroxyl group at 11th carbon. Mineralocorticoid hydroxyl group at 21 carbon. 21 carbon ring structure containing cyclopentoperhydrophenanthrene. Cyclopentoperhydrophenanthrene ring. Okay, so here there is a OH group, here OH group. 4 rings are there. Let's talk about testosterone. Testosterone. So here 19 carbons are there total and 2 oxygens are there. It consists of androgen skeleton. Keto group is present at C3 ring. Keto group is present at C3 on ring. Hydroxy group at 17th position. Uses male hypogonadism and in osteoporosis. Uses male male hypogonadism, male hypogonadism and यहाँ पे osteoporosis, male hypogonadism and osteoporosis, male hypogonadism and osteoporosis, male hypogonadism and osteoporosis. Hydroxy group at 17th position. Keto group is present at C3 on ring. Consists of androgen skeleton. Consists of androgen skeleton. Keto group is present at C3 on ring. Hydroxy group at position 17. Uses male hypogonadism and osteoporosis. Uses male hypogonadism. Hydroxy group at 17th position. Keto group at C3 position. Consists of androgens chain and total 19 carbons are there. OH hydroxy group at 17th and C3 carbon has ketone group. So it is uses is male hypogonadism and osteoporosis you can give. Okay, then let's talk about estrogen. Where is estrogen? Here. So estrogen, you will see four rings are there. Here identified the presence of hydroxy group at first and fourth ring. Presence of hydroxy group at first and fourth ring. फर्स्ट रिंग पे हाइड्रोक्सी ग्रुप है, इधर ओ एच आता है एक्चुअली. ओके, एंड फोर्थ रिंग पे ओ एच. तो फर्स्ट फोर्थ hydroxy group present at C3 on ring A and also at C17 on ring D. ठीक है, C3 एंड C17 दोनों पे हाइड्रोक्सी ग्रुप है. वेराज टेस्टोस्टेरोन में C3 पे कीटो है और हाइड्रोक्सी 17 पे है. ठीक है, पोस्ट मेनोपॉजल हार्मोनल रिप्लेसमेंट HRT therapy means hormonal replacement therapy post menopausal. For osteoporosis you can give testosterone, osteoporosis and the male hypogonadism. यहाँ पे फीमेल पोस्ट मेनोपॉज दे सकते. ओसीपीस में भी यूज होता है एस्ट्रोजन, पर ये नेचुरल वाला यूज नहीं होता. ओके, so it is identified by the presence of OH group at ring number 1 and ring number 4. जो रिंग नंबर 1 है उस पे OH ग्रुप रहेगा C3 कार्बन पे. रिंग नंबर 4 पे at 17 कार्बन. ठीक है, नेक्स्ट देखते हैं थायरॉक्सिन. थायरॉक्सिन T3 T4 triiodothyronine tetraiodothyronine. Two tyrosine rings are linked together by O. So those tyrosine rings linked by oxygen is thyroxine T4. T4 is called tetraiodothyronine, T3 is called triiodothyronine. Two tyrosine rings are together linked by O. Uses hypothyroidism and cretinism. Cretinism is seen in babies, right? In children. Sulfonamide. This is a sulfonamide. Sulfonamide में you will see SO2. Okay, sulfonamide functional attached to benzene ring have free amine group. It has free amine group. Okay, benzene ring have free amine group. Its uses are acute uncomplicated UTI. UTI. The use is UTI, uncomplicated UTI. Sulfonamides can be given to prevent infections in burns. Also, you can give sulfonamides. Okay. So you have benzene ring, free amine is there, and sulfonamide functional group SO2 and HR is there. Sulfonamide functional group is there. That's to benzene ring, free amine group, uncomplicated UTI, and to prevent infections in burns. Okay. One more is there, that is aspirin. Aspirin is also called sodium salicylate. Sodium salicylate को क्या बोलते हैं? Aspirin. Sodium salicylate is also called aspirin. Sodium salicylate is also called aspirin. Sodium salicylate is also called aspirin. Its use is NSAIDs. NSAIDs means non-steroidal anti-inflammatory drug. Analgesic, antipyretic, anti-inflammatory used in rheumatoid arthritis. It's all antipyretic, anti-inflammatory, antipyretic, but not different doses, not at the same dose. Okay. After this clarity, let's Let's do this structures. With what is this? Acetylcholine. How did you find? By seeing the quaternary ammonia. What are the uses of acetylcholine? It increases GI secretions, it decreases heart rate, velocity of conduction, force of contraction, and what? Force of contraction, it decreases force of contraction, it decreases heart rate, it increases GI secretions, force of contraction, velocity of conduction, heart rate decreases. Okay, on it acts on muscarinic and nicotinic receptors. It is polar, so it do not cross the lipid membrane. Okay, muscarinic and nicotinic receptors. Talking about dopamine, this is dopamine. How will you identify dopamine? There is a catechol nucleus. At for carbon 1 and 2 you have hydroxyl group and you have one amine group. It acts on D1, D2 and D1 receptors. Beta 1 uses as cardiogenic septic shock with severe heart failure and renal impairment. Okay, adrenaline. What are the use? A, B, C, D, E. How you will identify adrenaline? By methyl group here. Okay, anaphylactic shock, anaphylaxis, bronchoasma, cardiogenic shock. 2 D for prolong the duration of local anesthetic and epistaxis control in these cardiac arrests. Okay, adrenaline. How will you identify noradrenaline? There is no methyl group here. Okay, and H2 is there. Uses uses as cardiogenic shock with hypotension. Okay, acts on which receptors? Adrenaline on alpha 1, alpha 2, beta 1, beta 2. Noradrenaline on alpha 1, alpha 2, beta 1, beta 3. Okay, morphine sodium salicylate is this one. How you identify? Salicylic acid, CONA, will be there, sodium will be there. So aspirin, analgesic, antipyretic, anti-inflammatory. Okay, and blood thinner used in rheumatoid arthritis. Okay, morphine, how you identify? Pentameric ring, 1 2 3 4 5. Morphine, it's analgesic, opioid analgesic, antidote is naloxone, naltrexone, pentacyclic ring. Okay, then from this structure you can say two hydroxyl groups are there. Two hydroxyl groups are there. Third and sixth position. Tertiary amine group is there. Okay. Corticosteroid. How will you identify a corticosteroid? There are 21 carbons in corticosteroid. Cyclo cyclopento per hydrophenanthrin ring. 2, 3, 4. So this is the 5 carbon ring. Okay, 5 carbon ring is there means corticosteroid. Okay, for glucocorticoids, OH at carbon number 11, and for mineralocorticoid, OH is carbon number 21. Okay, it uses anti-inflammatory and adrenal insufficiency. How will you identify testosterone? At one carbon there will be ketone group from one carbon, OH group, C3 here. Okay, ketone and 17 OH. Male hypogonadism and osteoporosis. How will you differentiate corticosteroid and testosterone? Hmm? 1 2 3 4 rings. 1 2 3 4 rings. But in steroid you have two ketones in steroid. But in testosterone, one ketone, one hydroxy. Okay, but in two hydroxy, both are hydroxy, both are OH, both are hydroxy in estrogen. ये थोड़ा मिस्टेक है यहाँ पे. Oral contraceptive postmenopausal hormone replacement therapy and osteoporosis. So hydroxy group present in carbon number ring number 1 and ring number 4. Thyroxine is tyrosine groups attached by oxygen, linked together by oxygen. T4 tetra, T3 triiodothyroxine, 2 tyrosine rings linked by oxygen, uses hypothyroidism and cretinism. Sulfonamides, there is a benzene ring, one free amine and one sulfonamide group, functional group. Acute uncomplicated UTI, and you can use for to prevent infection in burns. Let's talk about the scientists. Scientists are important. Scientists are important, okay. Scientists. Yallapragada Subbarao. 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 Subbarao, what he did? He's an Indian biochemist. He discovered function of adenosine triphosphate as an energy source in the cell. He developed methotrexate used for treatment of cancer. He also got credited with synthesis of folic acid, a protective agent against anemia. Yallapragada Subbarao. Yallapragada Subbarao. Yallapragada Subbarao. Yallapragada Subbarao. Yallapragada Subbarao. Yallapragada Subbarao. So he discovered methotrexate Subbarao. Subbarao was very sad because he dealt with someone with cancer, so he produced methotrexate. He found out adenosine triphosphate as an energy source and folic acid. James Black. He's not looking black, but he is known for his work towards propranolol and cimetidine. It's lol, na? He's not looking black. It's lol. So propranolol and cimetidine. He studied effects of adrenaline on heart. Later, he developed propranolol, which was so he was studying an adrenaline and he produced some propranolol. It was named as the greatest breakthrough in the treatment of heart disease since discovery of digitalis. John Robert Wayne. He is English pharmacologist. English pharmacologist. He's an English pharmacologist. He's an English pharmacologist. John Robert Wayne. He shared the Nobel Prize in Physiology and Medicine for discovery concerning prostaglandins. So Robert so क्या the feeling नहीं होती prostaglandins he give for the pregnant ladies, right? So pregnant ladies, prostaglandins. Selman Abraham Waxman. He's walk he's standing but he's not walking. Everyone is showing their faces and sitting. He's the only one who is standing. Waxman. So Selman Abraham Waxman awarded Nobel Prize in Medicine for his discovery of streptomycin, the first antibiotic against tuberculosis. Streptomycin is the first antibiotic against tuberculosis. First antibiotic against tuberculosis. Discovery of streptomycin, the first antibiotic against tuberculosis. First antibiotic against tuberculosis was streptomycin, though it is not It is used still, but it is parenterally given, okay, not by oral route. So streptomycin against tuberculosis. Salman Abraham Waxman. He is Farid Murad. Murad, he talked about, he was very concerned with cyclic GMP as signaling molecule. He demonstrated that nitroglycerin work by releasing NO in body, which relaxes smooth muscles by elevating cyclic GMP. So he was very concerned about the cyclic GMP as a signaling molecule. Then he demonstrated that nitroglycerin work by releasing NO in body. This NO relaxes the smooth muscles by increasing cyclic GMP. Alexander Fleming, he is for discovery of penicillin, discovered enzyme lysozyme and the world's first antibiotic substance, methine penicillin from mold Penicillium notatum, which he was awarded Nobel Prize. He is the discoverer of Penicillium notatum. He was awarded Nobel Prize from the mold Penicillium notatum, methine penicillin. This is this is Vinca rosea. Scientific. Now let's study plants. प्लांट्स स्पॉटर्स करते हैं, उसके बाद ब्रेक लेते हैं इंस्ट्रूमेंट में। पहले ब्रेक ले लेते हैं, उसके एक बार ऐसे ऊपर से देख लेते हैं। नेक्स्ट वीडियो में हम डिटेल से करेंगे। प्लांट्स में दतुरा स्ट्रैमोमियम, दतुरा दतुरा को दांत है, मीन्स कांटे हैं, स्पाइक्स। दतुरा स्ट्रैमोनियम दतुरा स्ट्रैमोनियम, इसका फ्लावर देख लो वाइट कलर का। साइंटिफिक नेम एट्रोपा बेल्लाडोना, बेल्लाडोना। एट्रोपिन, प्री एनेस्थेटिक मेडिकेशन, मोशन सिकनेस, ऑर्गेनोफॉस्फोरस पॉइजनिंग के लिए देते हैं। एट्रोपिन ऑर्गेनोफॉस्फोरस पॉइजनिंग के लिए, मोशन सिकनेस सुला देता है ये एट्रोपिन। प्री एनेस्थेटिक मेडिकेशन सुला देता है। पापेवस सोमनिफेरम पॉपी प्लांट, सब पॉप कर रहा है ये, पॉप पॉपी प्लांट, और रेड कलर का पॉप है, पॉप स्टार, ओके, रेड कलर का। अल्कलॉइड अपटेन्ड आर मॉर्फिन, कोडीन एंड सैंग्विन। मॉर्फिन दर्द को खत्म कर देगा पॉप करा के, ओके। एंड जैसे कफ सप्रेसेंट, कफ को भी कम करता है। एक्यूट लेफ्ट वेंट्रिकुलर फेलियर में देते हैं। विंका रोजिया, रोज पिंक रोज है, विंका रोज है। साइंटिफिक नेम कैथरैंथस रोजियस, एंटी कैंसर ड्रग इन ALL, हॉचकिंस लिम्फोमा एंड विम्स ट्यूमर। हॉचकिंस, विम्स, उसमें देते हैं। मशरूम, मशरूम साइंटिफिक नेम एमानिटा मस्कैरिया, contains poison muscarine. Mushroom, hence the name muscarinic, attacks on muscarinic receptors M1, M2, M3 of parasympathetic system. Ergot, ergot गेहूं की तरह है ना। क्लाविसस पुरपुरा, अल्कलॉइड एर्गोटामिन, पार्किंसंस डिसीज एंड मेनोरेजिया। एरगॉट पार्किंसंस डिसीज एंड मेनोरेजिया में देते हैं। डिजिटालिस परप्यूरा, डिजिटालिस परप्यूरा से डिजिटल दिख रहे ना प्लांट, पूरे डिजिटल, ऐसे लाइट्स कैसे नीचे चमकते हैं ऐसे। डिजिटालिस परप्यूरा। फॉक्स प्लांट भी बोलते हैं। कार्डियक ग्लाइकोसाइड्स मेन कंस्टिट्यूएंट डिजिटॉक्सिन, टॉक्सिन, कार्डियक एरिथमियास एंड कंजेस्टिव हार्ट फेलियर में देते हैं। सर्पेंटिना, रॉयल वेलफेयर सर्पेंटिना, रिजर्पिन, हाइपरटेंशन, स्किजोफ्रीनिया, इंसोम्निया एंड हिस्टीरिया, हिस्टीरिया में भी देते हैं। रिजर्पाइन हाइपरटेंशन को कम करता है। शिजोफ्रीनिया, इंसोम्निया, हिस्टीरिया, हिस्टीरिया मतलब दर्द दर्द नहीं है फिर भी एक्टिंग, तो उसमें दे सकते हैं। रिजर्पाइन क्लिनिकल यूज हाइपरटेंशन, स्किजोफ्रीनिया। तो सांप को देख के आपको हाइपरटेंशन मिलता है, तो वही सर्पेंटिना, तो इसको देना है जो वोल्फ सर्पेंटिना। कभी कभार बहुत ज़्यादा सांप देख लेते हैं, हालुसिनेशन हो रहे हैं। स्किजोफ्रीनिया, इंसोम्निया, नींद नहीं आती है। हिस्टीरिया। कैनबिस, ये रेड कलर के सांप, ये इंच। कैनबिस, कैनबिस मरीजुआना, कैनबिस मरीजुआना। कैनेबिनॉइड्स ड्यूरिंग कीमोथेरेपी, क्रॉनिक पेन, मसल स्पैजम्स। तो मरे जा रहे, कीमोथेरेपी नहीं चाहिए बोल के, क्योंकि वॉमिटिंग होती है, तो वॉमिटिंग में मरीजुआना कैनेबिनॉइड्स दे सकते हैं। मसल स्पैजम, क्रॉनिक पेन। डिसिनस कम्युनिस्ट, ये कमीना कौन सा? लैक्सेटिव, अल्कलॉइड लिसिनिन, एंटी इन्फ्लेमेटरी, एनाल्जेसिक, एंटीसेप्टिक, एंटी एस्थमेटिक। फोकोमिलिया, फोकोमिलिया क्या है? हाथ पे छोटे रहते हैं, किसकी वजह से रहता है? थैलिडोमाइड की वजह से। प्रेग्नेंट में फॉर मॉर्निंग सिकनेस के लिए देते थे पहले। टेराटोजेनिक है, कॉन्ट्राइंडिकेटेड प्रेगनेंसी। लिम्स मालफॉर्मेशन नोन एज फोकोमिलिया। फीचर स्वेलिंग ऑफ गम्स, ड्यूरिंग ड्रग इंड्यूस कौन सा, फेनिटोइन एंड साइक्लोस्पोरिन। बहुत फनी लग रहा है तो अपना दांत खोल के, फेनिटोइन एंड साइक्लोस्पोरिन। ओके, ये हो गया। क्यूशिंग सिंड्रोम caused by prolonged use of corticosteroids, redistribution of fatty fat, body fat from peripheral to central parts like face, truncal obesity, moon face, centripetal obesity, पूरा पेट में obesity, centripetal obesity, acne, purple striae on abdomen, poor healing, hypertension, hyperglycemia होता है। तो this is caused by prolonged use of corticosteroids, Cushing syndrome। Rickets में defective mineralization and calcification of bones before epiphyseal closure due to defective vitamin D, phosphorus and calcium, cholecalciferol, direct exposure to sunlight. It is a congenital disease due to absent or deficiency of normal thyroid hormone. It is characterized by physical deformity, example dwarfism and mental retardation. Disease due to absent or deficiency of normal thyroid hormone. Exothermus autoimmune results due to increased periorbital edema and refraction of upper eyelids. Periorbital edema हो जाता है, autoimmune disease है ये। Alopecia areata, alopecia areata refers to pattern baldness caused by anti-cancer drugs, antifungal drugs and steroids की वजह से बाल झड़ते हैं। Alopecia areata, okay, refers to pattern baldness, male pattern baldness, okay। स्टीवन जॉनसन सिंड्रोम मेडिकल साइंस में फेशियल एंड टंग स्वेलिंग, पूरा टंग फूल जाता है, चेहरा फूल जाता है। रेड पर्पल स्किन ब्लिस्टर्स ऑन म्यूकस मेम्ब्रेन, स्किन म्यूकस हो जाता है, रेड पर्पल स्किन हो जाती है, रेड पर्पल स्किन। इंस्ट्रूमेंट्स मीटर डोज इनहेलर है ये, प्रेशराइज एरोसोल सिस्टम कंटेनिंग माउथ पीस, फिक्स्ड डोज ऑफ ड्रग इज इनहेल्ड, माउथ पीस से इनहेल करना है। मीटर डोज इनहेलर। रोटा हेलर क्या है, रोटा हेलर ऐसे छोटा सा डब्बा है, इसमें क्रश करके दवा जाती है, ओके। कैप्सूल कंटेनिंग ड्रग पाउडर इज इंसर्टेड इनटू द इनहेलर एंड क्रश, एग्जांपल सैल्ब्यूटामोल दे सकते हैं। स्पेसर में क्या है, प्लास्टिक ट्यूब विच इनहेलर इज कनेक्टेड, इनहेलर लगा देंगे एट वन एंड, ओके, एंड इज इनहेल फ्रॉम अदर एंड, दिस मेड इनहेलेशन इजी एंड इफेक्टिव। नेबुलाइजर यूज्ड टू एडमिनिस्टर मेडिकेशन फॉर्म of liquid medicine which turns into aerosol, जैसे bronchial asthma में salbutamol देते। Insulin syringe is longer, subcutaneously used. Tuberculin syringe is smaller, intradermally. BCG vaccine tuberculin test. BCG vaccine tuberculin test. Tuberculin test के लिए insulin syringe subcutaneously for diabetes mellitus patients and that is type 1 mostly. Insulin pen, ये पेन है, देखें syringe रेड कलर का है, ये पेन है एकदम, ठीक है, that is pen, used to inject insulin for treatment और composed of insulin cartridge रहता है इसमें एंड डायल रहता है, एडवांटेज कन्वीनियंस आता रहता है। ये काइमोग्राफ है, ठीक है, इतना बड़ा पूरा सिलेंडर विलेंडर है, मतलब फिजियोलॉजिकल रिस्पॉन्स सच एज कॉन्ट्रैक्शन ऑफ मसल्स, ठीक है। सिंपल लीवर, ये बहुत सिंपल है ना, सिंपल लीवर, दिस इज फॉर द कॉन्ट्रैक्शंस आर रिकॉर्डेड एज कर्व लाइन्स, कॉन्ट्रैक्शन ऑफ मसल्स आर रिकॉर्डेड कर्व लाइन्स। ऑर्गन बाथ, दिस इज ऑर्गन बाथ, क्या इतना बड़ा, ऑर्गन बाथ्स यूज फॉर स्टडिंग ड्रग्स, इफेक्ट्स ऑफ ड्रग्स केमिकल्स ऑन आइसोलेटेड टिश्यू इन विट्रो, यूज टू स्टडी कॉन्ट्रैक्शन ऑफ स्मूथ मसल्स। स्टार्लिंग हार्ट लीवर, तो सिंपल लीवर ऐसा ऐसा रहता है, हार्ट लीवर इज स्प्रिंग रहता है उसमें, कॉन्ट्रैक्शन ऑफ फ्रॉक्स हार्ट परफ्यूजन एक्सपेरिमेंट। फ्रंटल लीवर में ऐसे करके तीर की तरह आता है, फ्रंट जाना है तो फ्रंटल लीवर, कंट्रैक्शन ऑफ ऑर्गन्स इन रिस्पॉन्स टू ड्रग एक्शन। ये आर्टरी फोर्सेप्स है टू ग्रास्प कंप्रेस होल्ड द एंड्स ऑफ द आर्टरी ड्यूरिंग सर्जरीज। Pinch clamp is used to occlude any rubber tube to control or regulate the flow. This is ampoule made up of glass, small seal vial used to contain and preserve a medication, usually liquid form. Single dose of medicine. यहाँ पे vial multi dose, larger than vial. Inside can be stored and reused. IV set and cannula. IV set and cannula क्या है? ये है आपका IV set and cannula. This is the IV set and cannula. IV set and cannula. This is IV set and cannula. This is IV set with cannula. Allow the slow administration of drug over a longer period of time. Continuous infusion can also be given. Continuous infusion दे सकते हैं for longer duration, longer period of time. Continuous infusion. So this is IV set and cannula. Injecting IV fluids. ठीक है. Progesterone IUD with progesterone, okay, copper T की तरह. Use in birth control, heavy menstrual period, endometriosis, chronic pelvic pain, adenomyosis, dysmenorrhea, and anemia. This is a transdermal patch. Drug is delivered as skin surface by diffusion for percutaneous absorption into circulation. Used through this are nitroglycerin, angina, scopolamine, motion sickness. ये वायल है, ये जो कांच का आता है, ऊपर एक रबर कॉक रहते हैं, तो वायल है, ये पूरा एम्प्यूल है. ओके, ये रोटा हेलर है, रोटा हेलर. ये स्पेसर है. ये आपका है नेबुलाइजर विथ माउथ. ये कौन सा है? स्टर्लिंग हार्ट लीवर स्प्रिंग जिसमें है. ठीक है, ये फ्रंटल लीवर एरो की तरह आगे जाना है. सिंपल लीवर में एल शेप टाइप है. सिंपल लीवर इज सिंपल लीवर एल टाइप ना. सिंपल लीवर. आर्टरी 4 cells मीटर डोज इनहेलर पिंच क्लैम्प मेटल का है यहाँ पे. इंसुलिन पेन, insulin syringe, red insulin, tuberculin syringe.